Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. The world remembers more than 384,000 preventable malaria deaths in 2020 ahead of World Malaria Day, commemorated every year on April the 25th. Kano residents flout COVID-19 prevention measures during the Ramadan fast as health expert gives advice on how to stay healthy. And all eyes still on India as the country's coronavirus cases surge puzzles scientists. As the cases of COVID-19 continue to soar around the world, 100 cases were confirmed last night in Nigeria. Taraba State in the lead, but according to the Nigeria Center for Disease Control (NCDC), the data for Taraba State was recorded between the 11th and 21st of April 2021, with active cases at almost 8,000, most of which are in Nasarawa, Ondo, Delta, Lagos, and Adamawa, which have recorded over 700. Currently under admission. States like Niger and Kogi states have 0 cases on admission as at today.
The Nigeria Center for Disease Control has reported 100 new COVID-19 infections for April the 22nd, 2021. The new cases are from 9 states. Taraba leads with 64 cases, followed by Lagos with 21 and Rivers State with 4. States reporting the least number of cases are Akwa Ibom, Kaduna and Oyo with 2 cases each, and Bauchi and Nasarawa with 1 case each. This latest tally has raised the number of cases to 164,588. According to the NCDC, 137 people have been discharged in the last 24 hours after testing negative to the virus, raising the total number of discharged people to 154,578 since the beginning of the pandemic. There are currently 7,949 active cases of COVID-19 in the country, and more than 1.8 million tests have been conducted since the start of the pandemic. According to the National Primary Healthcare Development Agency, 57.1% of the target population have received the Oxford AstraZeneca vaccine, and almost 1.5 million vaccines have been given. This is as at April the 22nd, 2021. States with the highest number of vaccinated people are Lagos, Kano, and Kaduna. For almost 2 weeks, Nigeria has not recorded any death, keeping the death toll steady at 2,061.
The Minister of Health, Dr. Osage Haniwe, says Nigeria needs 352 billion naira to combat malaria in the country for 2021 alone. Speaking at a news conference ahead of the World Malaria Day coming up on Sunday in Abuja, the Minister of Health appeals for support from organized private sector and government as the COVID-19 pandemic has seriously impacted government revenue negatively. The National Emergency Management Agency, in collaboration with the Kingdom of Saudi Arabia, has distributed food palliatives to over 3,000 households who were displaced by the Boko Haram insurgency during the COVID-19 pandemic in Yobe State. The NEMA Director General Muhammadu Mohammed, represented by the Deputy Director Planning, disclosed this during the handover at Kasasai village in the state.
Boko Haram insurgency is the longest conflict in Nigeria that has displaced over 2.4 million people in the Lake Chad, according to the United Nations High Commissioner for Refugees. Although the military has regained control of most part of the country's northeast region, many are yet to return home. Over 3,000 persons were recently forced to flee their ancestral homes in Borno State and are living in these shades in Yobe State with no food nor means of livelihood.
The major thing that we are soliciting now is for sustainable livelihood support for stabilization. People have come in. There are IDPs that are willing to stay here. Government has given them land. So we would love if NEMA will improvise building materials, livelihood support to reintegrate them into the host community.
To bring succor to them, especially as a result of the COVID-19 pandemic, the National Emergency Management Agency is distributing 3,971 food baskets to the victims donated by Saudi Arabia.
I'll be going to Zamfara to flag off a similar donation. For Zamfara, it is 8,725 food baskets that were supplied.
These items will help many households, but potable water for drinking, cooking, and regular hand washing is still a challenge and must be addressed to prevent COVID-19 as well as other infectious diseases like cholera, especially with the advent of the rainy season.
Dr. Baba Goni, CMD, Yobe State University, member COVID-19 Prevention and Control Committee, joins us via Skype on the program for more. Thank you for joining us. All right, Dr. Goni, if you can hear me, give us an idea of the situation of internally displaced persons in Yobe State and what the numbers are now.
As far as the COVID-19 is concerned, Yobe State is having a coordinated effort in which we have an inter-pillar coordination through all the pillars, especially leadership and governance, risk communication, case management, and so on. At the moment, we know that as far as COVID-19 cases concerned, we're having a little bit 371 cases since the onset of the pandemic last year. Of recent, we've not been having much cases because of the efforts of the state government. Our mortality has been kept at a low level of 2.4%. Only 9 people died in the pandemic. At the same time, also, the state government has done a lot. It has now establishing isolation centers for all the zones of the state. At the same time, the state government has been providing support for all the people who have been infected. It's the only state in the distance of region that established a laboratory, a state-owned laboratory diagnosis center for diagnosis of COVID-19. So the situation has been very much contained. And then even at the height of the pandemic, we did not close any of our health facilities, cutting across tertiary, secondary, and primary health facilities across the state. And as a result of that, other healthcare delivery in other aspects have also been taken care of. As far as the IDPs are concerned, most of our IDPs are in the host community. We have a few IDP camps at Kasensa and at the same time at Kukareka, but they have also been taken care of through the State Emergency Management Agency and the Ministry of Health, His Excellency has established a high-powered committee, and ministry has been established, Ministry of Humanitarian and Disaster Management. So our IDPs have been well taken care of, apart from their health issues, also other aspects of their life have been taken care of at the moment.
All right, thank you so much. Having a bit of an audio issue there, but we would like to thank you, Dr. Baba Goni, CMD Yobe State University, member of the COVID-19 Prevention and Control Committee, for the latest there. Let's go over to Kano, where the state government says it is not relenting in the fight against COVID-19 in spite of the challenges to make residents observe the non-pharmaceutical protocols. A health expert, Dr. Abubakar Sadiq, explains that the first wave of COVID-19, which commenced during the Ramadan season, was more serious than the second is proving to be, is advising residents to stay healthy during the Ramadan fast.
Kano State had recorded close to 4,000 cases and about 110 deaths. As these are the figures as of now. Now, last year, the pandemic began in this environment shortly before we entered the month of Ramadan, and we've seen the effect that the Ramadan fasting has had on the number of cases, although it wasn't so easy to relate without conducting an evidence-based study. So this is the second experience we are now having, and we know that people have conducted studies in different countries trying to relate Ramadan fasting with COVID-19. But then we know again from scientific evidences that the effect Ramadan will have on the human body is such that the deprivation of food and water will place some pressure on the body. But then that has some positive effect as well as some negative effect. Now, talking about the positive effect, intermittent fasting, when people abstain from eating, will allow the immunity to concentrate on building itself so that it can boost itself, and then that will give some people some protection. However, the fact that there is fluid deprivation is not a positive thing. So in order to counteract that, it is good for people when they break the fast during the evening time, they take plenty of fluid along with the food they are eating.
Let's discuss some more about vaccinations and the variants. Professor Christian Happy, a professor of molecular biology and genomics at the Department of Biological Sciences, also director, African Center of Excellence for Genomics of Infectious Diseases, joins us now. Thank you for joining us on the program, Professor Happy. What is it about the coronavirus that it spreads? 1 minute we think it's under control, the next minute it takes us by surprise, and a very important case now is India. I mean, we're seeing different versions, or is it variants of themselves?
Yeah, thank you for having me. The coronavirus is an RNA virus. And because RNA is a molecule that is very unstable, so it's subjected to change. And that's the reason why you keep seeing the virus changing, mutating. Accumulation of mutation in the virus actually result in what we call new variant. And the variant can only continue if a transmission continues. And that's the reason why we say that people should try as much as possible to use both pharmaceutical and non-pharmaceutical methods. Pharmaceutical now that we have vaccines, and non-pharmaceutical methods, so like social distancing and wearing PPEs. As long as we have transmission, the virus will keep mutating, the virus will keep changing, and we will see new variants. The virus is trying to adapt, and as such, through the process of adaptation, it tends to be more virulent, it tends to be more transmissible. And that's exactly what result, as a result of mutation accumulating in the spike protein and other proteins of the virus. And therefore, we'll see new variants emerging here and there. So it's just a normal thing for a virus, especially RNA viruses.
Tell us about Nigeria's variants, the variants that we've been able to identify here, and which ones are of concern and which aren't at the moment.
Well, presently in Nigeria, we've, as I said before, we have over 55 different variants circulating in Nigeria. But out of the 55 different variants of the virus circulating in Nigeria, we have one variant of concern, which is a B117, variant that originated in the UK. Then we have two new variants that we discovered in Nigeria. One, the first variant that we discovered in my lab in Nigeria is the B1525, which is now a variant of interest. That variant emerged from Nigeria and then spread to the rest of the world, and it's really increasing very fast in the UK as well. There's a new variant that we recently described, which is a B11318, which is a variant that also emerged from Nigeria, and then in a country like Mauritius is also creating a lot of havoc there. So again, these variants are prone to emerge, and as such, we need to ensure that we continue to curb down transmission. As long as there's transmission, we'll be seeing new variants, and those variants, as time goes on, tend to be more and more potential and more lethal. So therefore, it's very important for people to get vaccinated. It's very important for people to ensure that they wear masks and then respect social distancing, even after vaccination, because there's been evidence that even after vaccination, if you don't respect this rule, there's a probability that you can get infected.
Professor Happy, always a pleasure. Thank you so much. Professor Christian Happy is a professor of molecular biology and genomics at the Department of Biological Sciences. Thank you for joining us on the program.
Thank you.
We have more on the global update of COVID-19 when we return. Please stay with us. Welcome back. The EU has secured a 1.8 billion coronavirus vaccine doses from BioNTech Pfizer, which would be delivered from this year through to 2023. European Commission President Ursula von der Leyen said at a press briefing today that it will secure the doses necessary to give booster shots to increase immunity. Meanwhile, in Germany, it's more restrictions, a harsher lockdown looming, but also more vaccines. Chelsea Delany, Deutsche Welle correspondent, joins us now from Berlin. Hi, Chelsea. Germany is once again facing new restrictions after Parliament passed an emergency break to strengthen lockdown measures. Germany has been in some form of lockdown since November. Is this going to help?
Well, there already are a lot of restrictions in place here in Germany, and there have been for months, and that has not stopped this third wave of cases that we've been seeing here in Germany and throughout Europe. But the new emergency break will institute stricter rules, and it also will institute these across Germany. So one of the problems that we've seen since the start of the pandemic is that every federal state was in charge of making their own coronavirus restrictions. This led to a very confusing patchwork approach of rules and lockdown measures. So this will unify the German restrictions, but it also will lead to stricter ones. So one of the biggest changes we're likely to see is a nightly curfew. This has been very, very controversial here in Germany. Many people think it's a violation of basic rights, and it's already been challenged in the Constitutional Court. But starting tomorrow, areas with infection rates above 100 per 100,000 residents will be faced with a nightly curfew from between 10 p.m. And 5 a.m. We're also likely to see stricter contact restrictions, potentially school closures. So this will escalate the level of the lockdown here. Of course, there's already a lot of lockdown fatigue after more than 5 months of restrictions. But given the fact that this third wave has not yet been broken, there was agreement among politicians that there is a need for stricter rules for the time being.
On the other hand, the EU spat with AstraZeneca continues to escalate. The Commission is considering suing the UK drug maker for missing its vaccine delivery targets for the EU. What could come out of this?
Well, the main goal of this would likely be to put more pressure on to AstraZeneca to maintain its promises to Europe. The EU has been very publicly frustrated with AstraZeneca because the company has fallen short of its commitments to Europe. AstraZeneca was supposed to deliver around 300 million vaccine doses to Europe by the end of the second quarter. They're now only expected to deliver about 70 million doses, so they've repeatedly fallen behind on their planned deliveries to Europe. The EU has tried to really solve this by talking to AstraZeneca, by holding meetings and discussions with them. But I think they're hoping that this will add another leg of pressure onto AstraZeneca so that they will keep these commitments and so that the EU's vaccination campaign will stay on track.
Deutsche Welle correspondent Chelsea Delany, thanks for that update. Now, over in India, the healthcare system is under immense pressure as a record surge in COVID-19 cases puts pressure on hospital beds and drains oxygen supplies. Families are left pleading for their relatives who are desperately ill, with some patients left untreated for hours.
A police escort helps offload an oxygen tank at a hospital in New Delhi. It's an important task as medical oxygen is now precious in the country. India's seen a dire shortage of it as it reports the worst daily rises of new coronavirus cases seen anywhere. Hospitals are overwhelmed with patients suffering with COVID-19. Indian media reports say at least 25 patients have died in the last 24 hours at a hospital in capital New Delhi after they ran out of oxygen supplies. India has reported the world's record daily caseload for a second straight day, with over 330,000 new cases. India's total caseload has now passed 16 million. Deaths in the past 24 hours also jumped by a record 2,263 to reach a total of 186,920. Drone footage shows images of fires from mass cremations and bodies being carried on wooden planks. As the virus surges, Indian healthcare providers are appealing for emergency supplies of oxygen. Similar desperate calls from hospitals and ordinary people have been posted on social media for days this week across the country. Prime Minister Narendra Modi, whose government has been criticized for relaxing restrictions too quickly, says the government is making a continuous effort to increase oxygen supplies, including steps to divert industrial oxygen. Prime Minister Modi urges states to work together to meet the needs for medicine and oxygen and to stop hoarding and black marketeering.
The World Health Organization Regional Office for Africa is calling on high-income countries to share their supplies of COVID-19 vaccines with African countries, as limited supplies are constraining vaccination efforts on the continent. A total of 41 African countries have obtained more than 18 million doses of vaccines through the global COVAX program, but vaccine rollout efforts are being hampered by systemic obstacles to distribution on the backdrop of rising coronavirus cases.
I'm concerned that 7 countries have now used up all of their COVAX doses and will need to receive follow-up doses from early May to mid-June. WHO and COVAX partners continue to engage in intensive negotiations to ensure that African countries will get their second doses of the vaccine in a timely manner. We also encourage countries that have not been able to use their doses and high-income countries that have vaccinated their most at-risk groups to share their supplies with the few remaining countries that have not yet received a shipment.
Let's see some more stories on our global update.
Let's first take a look at Japan, where earlier today, Prime Minister Yoshihide Suga declared a state of emergency over COVID-19 in Tokyo, Osaka, Kyoto, and Hyogo. This will come into effect from Sunday, April the 25th to May the 11th. Japan has seen 550,000 cases and 9,761 deaths, which is significantly lower numbers seen in other large economies. Russian President Vladimir Putin is set to sign a decree that will make May the 4th to the 7th non-working days and extend a public holiday period at the beginning of the month due to the coronavirus outbreak. Deputy Prime Minister Tatiana Golikova also confirmed that Russia has administered both shots of a COVID-19 vaccine to 6.8 million people, while 11.1 million people have received the first shot. Pope Francis visited homeless and needy people getting free COVID-19 vaccines from his Vatican charity today as he celebrates his name day, the Feast of St. George. About 600 of the 1,400 people who received the first dose several weeks ago got their second shot today. Francis, who has been vaccinated, as has former Pope Benedict, says getting a shot is the ethical choice unless there are serious medical reasons not to. Finally, panic buying is underway at a local supermarket in Perth, Australia, following the Western Australian government announcing a 3-day lockdown. The supermarket says it will not introduce limits on purchases.
Continue to protect yourself and take responsibility. You can visit our website. It's channelstv.com for more on the trends and stories making the rounds on COVID-19 and other sectors as well. Politics, business, sports, it's all at your fingertips. Thank you for watching. I'm Millicent Walker. Stay healthy.